Hi guys, this is Lisa. I'm doing my 4-week post-op video. I think I missed week number 3. I think I did one at 2 weeks, but now I'm at 4 weeks post-op of upper jaw surgery, where they shaved down the back of my upper jaw 3 millimeters on both sides, and then they also moved this upper jaw forward, as you would probably already know in my last videos. Um, Let's see. So I'm going to kind of go over physically how I'm doing and then emotionally how I'm doing. So this is one of the hardest things for me right now is that I can't really smile because my upper lip and face and nose and even under my eyes are still numb, of course, because it's only been 4 weeks. So my smile basically only goes this far with my upper lip. So it just kind of looks really odd because I can't really smile all the way. And that's really difficult when you have children, and of course, they want you to laugh and smile. And it hurts too because I still have the stitches and it's still swollen. So that's been hard. The swelling is, like I said, still up in here and under my eyes, and still up in here. You probably can't tell because I've seen people, and they're talking to me like normally, that didn't know I had jaw surgery, and I have to tell them that I had jaw surgery. So it's really strange because you feel so swollen and you probably don't look as bad as you really feel, and you just don't know. And people will tell me all the time, oh my gosh, you look so good, but I don't think that I look so good because I can feel the swelling. I personally can see the swelling, and I have, the feeling of it. So it's harder. But people I don't think can see it, but I can. So I can only open my mouth this far. And that's what I've been told, that's normal for around a month. And it gets, by 3 months, I should be able to open my jaw fully. That's what I've been told. We'll see. The stitches do burn as you start getting feeling back in your upper face. You start to feel things, which is good because you know that your nerves are working. But it also is not good because you start to feel, more, not more pain, it's just the more discomfort. So right in here, like all where the stitches, I have dissolvable stitches in my mouth. So I'm thinking that they just fall out on their own. I'm not really too sure if I will ever see them. So I get burning sensations in here, and I think that also has to do with the nerves. I'll just get kind of like a shooting burning sensation. It doesn't last very long, and it really doesn't. The burning sensation doesn't bother me. The discomfort of the stitches and the tightness, that bothers me. But that'll go away. Obviously, it's not going to be like this forever, so you just have to be patient, which is really difficult. It's been really hard. My nose is, obviously they moved that all forward too, and I've got stitches in there. So I have not yet been able to blow my nose, which is quite irritating because I just want to blow it. So, and it's sore and it hurts all up in here and it's super tight. And that's, as I've watched other people's videos, that seems to be the norm at this stage. So I just have to try to be patient and know that hopefully that will go away and the swelling will go down and it'll get easier. My energy level is super low because I can eat more or I can consume more food, but I still am not consuming enough so that I have a good amount of energy yet. I am pretty tall, and I have 2 children. I have a 4th grader and a pre-K. So it was really difficult for me having them home over Christmas break and my husband going back to work, because I just don't have any energy. So that was really hard, and it's continued to be hard because they want to ride bikes and I don't have any energy to be able to do those kinds of things. So that of course will get better once you can eat more. So I will be doing videos when that gets better and me sharing that with you. So hopefully that happens within the next 2 months. My weight, I was about 125 pounds, which is underweight for my height because I'm 5'9", 5'9" and a half before surgery, because I couldn't eat for about 2.5 years before surgery. So it's been almost 3 years not been able to eat regular food because my bite was so open. So I was skinny before surgery, and now I'm at like 119 pounds. So I'm assuming, I don't really know how much weight I lost, probably a good 10 pounds maybe with the surgery. He said he only wanted me to lose 5, but I really don't know because I didn't weigh myself after surgery. After like a week or two, I just weighed myself and I weigh about 120, I want to say. So that's good. It's not too much weight. I'm putting back on weight, I think. So in the last 2 weeks, I think, yeah, in my last videos, I talked about having thrush from the antibiotic, which is the fungi and yeast in your mouth. Well, unfortunately for me, I also got another yeast infection from that. So I had to take medication for that last Monday, I think. Yeah. And today is Wednesday. So I'm good with that now. I did have an allergic reaction also to a superfood that I wasn't putting in my shakes, but I added to my shake, called like green algae or spirulina, and I had an allergic reaction to that. So I'm in bed today. I'm not like, it's not bad or anything, but definitely not something you want to go through while you're recovering from jaw surgery. But I guess now I know that I'm allergic to it, which is a good thing. So sleeping is so difficult because of the rubber bands. The rubber bands, I don't have them in right now, but I have a triangular shape. The oral surgeon did say that I didn't have to wear them at night, as long as I just wore them a lot throughout the day, because they're causing me so much pain in my teeth that I can't sleep. But I'm so nervous about not having them in at night, so I struggle with sleep because I'll have them in and then I'll take them out and then I'll get nervous about it and put them back in because I just don't want my jaw to relapse. So that's been difficult. I do go see the oral surgeon tomorrow, so I will be asking about that. And then I do go see the orthodontist within the next week or two to start his work, I guess. So I'm hoping that he takes all that out. He takes out this wire and takes out these surgical hooks, and hopefully my sleep will get better after that. So physically, that's what's going on. My diet's the same pretty much. It's just soft food or no chew diet. And what did I start eating? The cottage cheese. And then, the little packs of tuna, I can actually put mayonnaise in that and mash it up and eat the little packs of tuna, which has been a really huge help. So it's just still soft food and no chew. Chewing is just really, I tried chewing and it's uncomfortable and I kind of don't know how to do it since I didn't have any contact on my molars. And now I do, I just kind of don't know how to chew. So I'm just going to wait for them to tell me when it's okay and start taking classes, because I need to take classes on how to chew properly. Emotionally, like I said, not being able to eat real food, I've been dealing with that for about 3 years. So I know how emotionally taxing that is. And that's still very difficult to deal with because you just want to eat. And you just want to eat what other people are eating and not worry about, being in pain or messing your jaw up, or you just want to eat comfortably. So that's why I did this. So that's hard to deal with emotionally. I can't really laugh or smile with my kids, which is really hard to deal with But I'm just trying to look, be positive, and know that that will happen in the future. Um, and getting used to the way that I look is very difficult too. I don't look in the mirror very much because right now I don't like the way that I look. But I still have swelling and I still am uncomfortable and I still don't know what my smile's really gonna look like. So, and I had this really long face before, and that's been really difficult. I mean, I'm 40 years old, so um, these things they told me were going to be hard for me because I'm a little bit older. Well, a lot older. So I'm dealing with that, which is hopefully all of those things will get better with time. I do go to the oral surgeon tomorrow, and then I do go to the orthodontist soon. And when all of that happens, I will do another update, and hopefully, I will be out of these surgical wires, and hopefully, I'll be able to eat more food and have more energy. I did check my YouTube because my kids are back in school. So I don't see any questions. I know people are watching, but I don't see any questions, which I don't know if I just don't know how to find them because I don't know very much about YouTube. Um, so I'm going to keep looking, and I'm sorry if I'm not answered any questions because I don't know where they are. And, or maybe I'm just answering all your questions in my videos. So thanks for watching, and I'll see you in a few weeks. Bye.